Warfarin. Review for current users. Introduction. If you miss a warfarin pill, should you add it to the dose of the next day? Select yes or no. Correct. If you miss a dose of warfarin, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. Do patients who are on warfarin have to avoid certain vegetables? Select yes or no. Correct. When you take warfarin, you can eat any vegetable you want, but it is important that you keep the amount and type of vegetables you eat regular. Changes in the amount of vegetables you eat can make your INR too high or too low. Can patients who are on warfarin play any sport they want? Select yes or no. Correct. Because patients on warfarin are more likely to have internal bleeding, they should not play contact sports, such as football. Check with your healthcare provider before you start a new exercise program or sport. The warfarin pill should be taken at the same time each day. Select true or false. Correct. You should take warfarin at the same time each day. If you are a few hours late or early, it is okay to take the pill. However, if you forget to take the pill for more than 12 hours, do not double the dose. Should patients taking warfarin take over-the-counter medicine without first checking with their healthcare providers? Select yes or no. Correct. Other medicines can change how thin the blood is. You should check with your pharmacist and healthcare provider before taking any medicine, including over-the-counter medicine. Taking warfarin while pregnant raises the risk of birth defects in the fetus. Select true or false. Correct. It can also cause excessive bleeding during delivery. If you are thinking about becoming pregnant, are pregnant, or want to breastfeed, talk to your healthcare provider about warfarin therapy. Internal bleeding is more likely when blood is thinner than it should be. Select true or false. Correct. Internal bleeding is more likely when the blood is too thin. If you see signs of internal bleeding, such as dark urine or stools, call your healthcare provider right away. If you follow the exact prescription of your healthcare provider, is it possible for internal bleeding to happen? Select yes or no. Correct. Internal bleeding can happen even if you follow the prescribed dose. That is why it is important to tell your healthcare provider if you notice any signs of internal bleeding. Minor bruises are a normal side effect, and you do not need to call your healthcare provider. Select true or false. Correct. Minor bruises are normal and do not need a healthcare provider's attention. However, large areas of bruising or unusual bruising are not normal, and you should call your healthcare provider if they happen. Thank you for using Explain.